I was born and raised on the Gulf Coast in Gulfport, Mississippi. Looking and viewing the hurricane that was erupting at that particular time in Louisiana and the Gulf Coast did something to me. It touched me really, really hard because I could see those people that were needing assistance, and water was rising, and it appeared to me that enough help wasn't going forth at that particular time. And see, I began to think, what can I do to help? It's got to be something that I can do to help. And all of a sudden I decided, okay, I didn't have a whole lot of money, but I did have this home in Arizona, this winter home. I said, I'm going to put this house up for sale. So I called the realtor the next day, put it up for sale. It sold in 23 hours.
I read about Pastor Mary in the Oregonian. There was a piece about her. And I was really inspired by what she did, which was basically just decide these people need help, and I can't help all of them, but I can definitely do something for some of them, and I'm going to do it. So she sold her home and got the money together and did what she did.
And when I came back, one of the young ladies that was accepting donations said, oh, there's a doctor that came, and her name is Dr. Jill Ginsburg, and she works at Kaiser. And I met her outside. And I said, you know what? We need a medical clinic. She said, well, how can I help you? And I said, we really need a medical clinic in this area. I said, there are a lot of people that we've brought in that need medical attention. There are other people in this area that need medical attention, can't afford it, laid off from work, can't afford the medication or doctors. And I said, we could get a medical clinic established, open again. And I said, I feel like we could talk to these hospitals to get them to donate the lab work and probably some pharmacists to dedicate the medication. We could do it.
Before I left her that day, I realized that she had inspired me by what she had done, and now she was giving me an opportunity to do something also of service and something that would be amazing for the community. And if I had just walked away from it, I think I would have felt terrible for the rest of my life about that.
These are two women whose work embodies what Dr. King talked about, beloved community. Their work is an expression of beloved community, putting in place services that are desperately needed by people who need health care, and they need their health care right now.
I couldn't afford the health coverage. I couldn't afford to, if I got sick, to go to a hospital, because of health insurance.
I was having difficulty paying for prescriptions because I had no insurance. How could I pay for lab fees in addition?
I got the cab company going. I just got one car, but just starting out, so it's still rough and still no medical insurance.
I've run across a lot of people that just have been really sick but didn't have the funds to go to a clinic, and they like, I don't know what I'm gonna do.
We serve adults only, uninsured, and low income. So it's people, many people have lived in the neighborhood for a long time and don't have health insurance, either because they're unemployed or because their job doesn't offer health insurance, or they can't afford the insurance option that's available.
People here who don't have health insurance benefit greatly, not only because the clinic is here, mainly because of the staff.
The place is genuine. It's something that you feel when you walk in there. They greet you in such a way that you know that you're going to be helped, or you're going to receive the utmost care. When you walk through that door, you know that you are somebody, you're very special.
They know we're here because we're passionate about healthcare, and I think sometimes the message that we give them is even stronger, that they need to take good care of themselves, not only for their families, but also for the community as a whole, that their health is important to all of us.
There are doctors and nurses that are concerned because they're off the clock, they're not getting paid, but they take the time out to come in to see you. I think that's awesome.
I would say that the Northeast Clinic is a wonderful place. You should come in and experience it. They met my medical needs, and they have my medical condition under control, and without them, God only knows what would have happened.
I speak highly of this place because literally it saved my life. It helped maintain, you know, my health to where it is now.
If this clinic wasn't here, you know, I probably would be dead. Where would I get the money to get the medication?
The fact that people can come here and find quality care, compassionate care is a good thing. It's a blessing to our community.